Welcome back to MovementProfessional.com. We're here again with Dr. Aron McConnell. He did a video about the use of the foam roller for some soft tissue work. Now we're going to talk about using some different balls at different sizes. We have a lacrosse ball here, and we have two. This is from YogaTuneUp.com. This is the Yoga Tune-Up Ball Plus, and this is the Alpha Ball. I mean, you can use a variety of different balls. We just wanted to show you different sizes of balls, and then there's also some different textures involved in that you can play around with. But basically, just having a ball, all the different areas you can work on. So I'll have Aron take it away. Go ahead, Aron.
All right. So, this is a lacrosse ball. Most of the time I tell people to start off with a lacrosse ball, tennis ball. If you've got a lot of tenderness or a lot of restricted tissue that you need to slowly get through and you can't tolerate really pushing hard on it, you can go as soft as a racquetball to be able to start things off. So, a lot of the times with a foam roller, it's great to get to the larger muscle groups. Some of the smaller muscle groups in specific areas of the body are a lot harder to get to, and so you're better off to use a ball. I'm going to show you how to kind of do it up against a post, but you can also kind of envision this being the floor if you want to put a little more pressure into it by using gravity to your advantage, particularly when you're getting in some around the hip muscles. And also we're going to show you how to be able to use it for the hamstrings and the calf. So we start off with, to get to the chest area, you kind of take the ball, pin it up against the corner of the wall, that way your head and your shoulder can kind of dodge the area. So you can come up to it and place it right into the chest muscles here. And you'll find different spots that are restricted, and you can start off just by kind of exploring it a little bit to see, okay, where are the tight spots? Do you feel like you're rolling over a cord or something else of that nature? That could very easily be found on a lot of people because we tend to all be pulled forward into that forward head sitting posture, and that pulls our shoulders forward and our chest tightens up in response to help to stabilize the shoulder. So you can kind of roll over top of those areas, either side to side along the striations in the muscle, or you can go kind of across them up and down in different ways. Another good thing that I've had people do is that once they kind of find a spot, and the nice thing about the post is that it clears space. So you want this to kind of be the corner of a wall or a door frame. He's raising his arm up to kind of get some stretch into the muscle and then bringing it back down. As your arm comes up, you're bringing the thumb back, and he's going to switch sides to show you. You're bringing the thumb back as your shoulder externally rotates as it comes down, and you bring it down and internally rotate behind the back. And that's moving that chest muscle through a stretched out and then completely shortened pattern to really get that muscle to work through all the patterns for it. There's also a deeper chest muscle, pec minor, which is another big one that tilts the shoulder blade forward when it's not balanced appropriately. That one you can also get into there. You might have to come a little more lateral. So if everyone finds their armpit, you slide over maybe 2 inches, and that's kind of right over top of that pec minor. And that's also one of those other muscles that's really good to get into using this. And like I said, whether you're using a lacrosse ball, tennis ball, some of the other balls that Chris mentioned, there's a good ways to be able to get into the chest muscles. Another couple of things you can do is going into the mid-back, into the thoracic area. So if we have Chris come over, if you got a specific trigger point, say in the rhomboids of the traps, then you can kind of just come back and back up against the wall and just pin the ball there and kind of lean back against it, and you can find some spots that might be tight. Again, you can sort of imagine laying down on the ground. It's a little more of an aggressive form by comparison to what was on the foam roller video, and you can use both the shoulder to move, you can raise the arm overhead, which naturally is supposed to bring the thoracic spine into extension. And so in which case, if you're having trouble with that, pinning that section down and moving the arm is kind of like a self-mobilization of the thoracic spine that can sometimes be helpful for it. Or you can just be working on the muscles, whether it's the vertical erectors of the spine, or you can go more into the shoulder muscles. And Chris is also pulling through his head because the traps come up and the levator comes up and connect to the back of the head. So if you change your head and neck position, that changes that upper thoracic alignment, but also pulls on some of the muscles that attach to the shoulder blade so you can get further mobilization of the tissue. So we can come on out, and Chris can actually just move right lateral onto the back of the shoulder blade here, and that's where we can get into the rotator cuff. So again, those rotator cuff muscles on a lot of people tend to be restricted because as that shoulder comes forward, it dumps the shoulder joint out of position. So when it does that, your rotator cuff really are just trying to pull it back into space. The problem is they don't have control over your shoulder blade, so they end up putting a lot of stress into the rotator cuff, and that can limit both overhead movement, behind the back, causes a lot of pain inside of the shoulder if it becomes irritated, and that's one of those places that's kind of hard to get to with a foam roller, but much easier to get to using a lacrosse ball. More aggressive if you're laying down on it, but it also lets you kind of relax your body, versus in standing you have to kind of keep your body tense a little bit just to stay upright. And he's again moving his arm in and out of different patterns to kind of get those muscles to lengthen and shorten to really loosen everything up. It's a little easier position when you're laying down on, so you don't have to like worry about losing control of the ball and having to drop down to the floor, but it's just another way to be able to get into that. So we're going to go to hamstrings.
Yep.
Alright, so at the box over here, so Chris is going to have a seat. So hamstrings kind of one of those tough ones to get to in specific points because you can't really get as much pressure into the foam roller. So Chris takes this and places it right underneath one of his hamstrings. Now it's kind of pressed up into the muscle. What he can do from here, if he sits up really tall, that pulls the pelvis to kind of put tension on the hamstrings from the top. And then from there, he can just easily slowly kick that right leg straight, and that ball is pushing up into the muscle as that muscle pulls into tension, and so it'll really pull out those restricted areas. And you can obviously sit further back, further forward on the box, or even just like a hard wooden chair works really well to kind of get into those muscles to loosen them up. You can obviously work on both sides. Realize also that the hamstring splits, so the higher up you are, you're more towards the central attachment of the hamstring on the pelvis, but as that muscle comes down the leg, it's going to split, so you may need to be a little more off to the one side on the outside or the inside, depending on which hamstring muscle you find where you have the most restriction for that. So, anything else you want to add to that?
Yeah, it feels good. One of the things I will mention is like you're doing this in the comfort of your own home, and even in a clinical setting where you can kind of be off, and the less clothes you have on, the better, because if you're on the skin, especially with some of these surfaces, one, the balls may be a little slippery and slide off the surface of your skin, but they'll sink in nicely to the skin tissue there, and that does make a difference because there are different layers of the fascia what we're trying to work. So just by having that grippiness on the skin, you're actually going to get some movement at this superficial layers.
Yeah, that's great.
So birthday suit myofascial release is recommended.
Alright, so we just showed you a couple different ways to be able to use the cross ball, tennis ball, what have you, with posted box or like a hard chair, and we just want to show you a couple of quick things that you can do on the ground. Probably the first one I would go to is the calf, because again, we get a lot of restrictions into our calf, sort of from wearing heeled shoes, and even just from a lot of our sports that involve a lot of toeing off the ground and push hard, we end up with a lot of those restrictions. So the best way you can get to the calf is with a lacrosse ball. So you kind of stick that right underneath the calf, and again, you can kind of explore around to find some different tight spots, stack the other leg on top to get a little bit of extra pressure, and again, you can sit into it and just wait for it to release, or you can move the ankle up and down, move the ankle in and out, and that'll let you kind of find where those real tight spots are throughout the calf. And you can work throughout the entirety of the calf. You can work almost all the way down to the Achilles tendon. You can work through here, and you can work all the way up into the top of the calf. You don't want to be directly behind the knee, just because that tends to be a very vulnerable place. A lot of arteries you don't want to mess with in there. But the calf muscle does go to either side, so you can work throughout the entire back of the calf in order to be able to loosen things up. And you'll find some really awful spots in there, and sometimes you just got to sit on it and just wait for it, try to let the muscle relax. You don't want it to be tense on top of that. You can also use the ball if you're going to bring it up to the hamstrings or up into the quad. You can do that as well. So if we have Chris lay down, just because I'm feeling sadistic, so we can take the ball, stick it right underneath of that quad right there, and have Chris kind of find one of those awful spots that'll just make him wince a little bit. And again, just shut the leg down, you'll find some awful spots you may not even want to move, or you go to move and you're like, oh god, that's just awful. Alright, don't have to always move with it. Chris is having fun with this, so you can work on that. You can also bring it a little more out to the side. That's that your quads are split into 4 different groups. So you can go more to the inside, more to the outside, just find some spots. That can then go right up to the hip to get into the TFL. So again, TFL is right here on the front. That's one of those ones that tends to tighten up a lot. And as that tightens up and pulls the pelvis forward, it inhibits our hip muscles. So if we can really loosen up the front of the hip, that lets our hip push through, and that's a critical piece for maintaining good upright posture, but also getting the appropriate power off the hips. And so he's kind of brought his knees up. You can do it with knees up and shorten the muscle to really get deep into it, or you can straighten them out to lengthen it out. And you can roll on it. You can find a spot with it and just hang out. You'll probably find some spots. If this refers down the leg and into the knee, I've had some people even complain of referral into the ankle. That's not abnormal. So there's a lot of, we get a lot of tension into the IT band on the side of the thigh, and that can be caused by putting pressure into those muscles. A lot of times people who are complaining of that lateral knee pain or IT band syndrome, part of the problem is the fact they've got a lot of tightness in their TFL, possibly also their glute max on the back, and that it's pulling abnormal tension down into the IT band, and that's kind of making the side of the knee suffer, but really the problem's up in the hip. So you can also work on lateral and posterior glutes more or less by sitting on it the same way you did with the foam roller. And again, it's just a little more pinpoint, so you're going to find some spots in there that you didn't know were there with the foam roller, and that can help you kind of target that. Chris is putting a decent amount of weight in his foot and his arms to be able to avoid really cranking into it, because sometimes it is just a little too painful. You can always back off of it as far as being able to do that. I'll sometimes lay it all the way down when I've got that pushed into the side of my hip, just to kind of distribute the weight a little bit more so it's not as aggressive, because if it is too painful, you're going to avoid it, and then it's just not going to accomplish the goal that it's after. Same thing that we worked on for the mid-back and also for the back of the shoulder inside of the rotator cuff can also be done on the ground. And it's, again, you're using your body weight, so it'll be a little more aggressive than doing it on the wall, but still very effective. And if you can tolerate it, you can definitely go with those as well. Anything else on that?
No, you covered it all. Yeah, so all you need is one tool. Okay, I didn't have a foam roller. We did a video on that. You use the foam roller, you can pretty much hit most of the areas in the body. The ball is a lot more specific and pinpoint, but you can still, as Aaron showed at the front of the thigh, you can still hit some of those bigger muscles. So you don't need a lot of equipment to get a lot of benefit throughout your whole body with this stuff. Okay. Thanks a lot, Aaron. See you next time.